Testing is critically important, and if you want to talk about trying to get states reopened, it's part of the president's own plan that a very important criteria is downward numbers, and to make sure that you have the testing and the contact tracing in place so that we can identify the people that are sick and have the virus. You can't do that without adequate testing. Now, the federal government has taken some real steps and positive steps in that direction, and they're ramping up. They're using the Defense Production Act to get swabs, and they're helping on trying to identify some labs where you can help the states. But states have been competing on the open market and the domestic market and the international market throughout this entire crisis, competing with each other and with the federal government. And I'm not sure it should have been that way, but that's the way it is. That's the way the president said it had to be. And so that's what we were operating under. I was very pleased. My wife, who was born in South Korea, we have a very good relationship with President Moon and the First Lady of Korea, with the ambassador here. And we worked really hard to get this done. And I want to thank the people of the Republic of Korea for their assistance, these great companies. And it's going to help the people in my state. The president has said that the states really are on the front lines and need to go out there and get this testing done. That's exactly what we've tried to do. We have been working very hard, as have been the other governors around the country, to try to get testing from domestic companies all around America, but also from around the globe. We were very successful after more than 3 weeks of negotiations to get the assistance of South Korea and a couple of South Korean companies to get these tests delivered to our state. It's a tremendous accomplishment. We now have more testing capability here in Maryland than the top 4 states in America have done all the way from the beginning of this crisis added together. So it's going to help us get to the point where we can reopen our state and get people back to work. Having the adequate testing has been a huge part of the trying to get things back to normal. Well, so the president's own task force, in his report that came out last Thursday evening, his coronavirus suggestions and guidelines for states, says that you need to have declining numbers in your state for over a 14-day period. I'm not sure of what the numbers are in Georgia. They are able to. He said each state should be able to make their own decisions about what's going on in their own states, which I think was a smart policy. But in our state, unfortunately, the numbers in the Baltimore-Washington corridor, in the Maryland, D.C., and Virginia area, because of some of the early and aggressive actions that we took to flatten and lengthen the curve, our numbers are lower, but we're on the rise. And in the Washington area, we just announced here today in our region 25,000 cases and 1,000 deaths. So we're not able to start opening things up. It's the wrong time, according to all the experts and according to the president's own plan. But I'm just as anxious as anybody to get our economy open when we could do it in a safe way. I'm a lifelong small business person who I feel for the people that are not able to work, and I feel for the small businesses that are suffering. But we want to make sure that we're going to announce later this week a safe road to recovery and reopening. But we can't do it until we see those numbers start to decline, and we're going to do it in a very safe way based on the advice of the best scientists that we have here in our state.